Yay Networks.
Welcome to Greg Louganis is Alive, the podcast that will challenge what you think you know. I'm your host, Greg Louganis, and yes, I'm still alive. And I'm joined today, as every day we do our podcast, with my friend and manager, Beth Zinman.
Hello.
Hey, Beth.
Hi. So I am, of course, as you said, delighted to be here. Always delighted to be with you.
Yeah.
It's funny. I'm just going to throw this out there. So we work together, obviously, right? It's like sometimes when you work with family, it might not be so smooth. Maybe you need a break. But I have to say, Greg, those things don't really happen. I really enjoy talking with you. I wish we had more talk time, because we've had some really fun conversations.
Oh, yeah. It's fun.
So what's happening today?
Okay, so today we'll be discussing LGBTQAI plus healthcare. And, it's just the whole healthcare. It doesn't matter what group you identify with, it's hard to navigate healthcare.
Yes, 100%. I think hard for anyone. I know that you and I discussed your stuff. Actually have other family members in that community. I'm going to have a stab at it. Let's see. LGBTQ. I always mess it up. Is it AI or IA?
I'm dyslexic, so either works. So
as long as we're including everyone plus, right?
Right, plus.
Right.
And there are certain, because I know because I was diagnosed HIV positive in '88. And there was a whole mess of stuff, surrounding that. And I didn't want to claim it on my insurance because I was afraid they would out me, my HIV status. So,
that's a great point. Yeah.
Yeah. So it was, I paid cash for, hospitalization, for medication, all of that stuff. So, trying to navigate that to, kind of keep it out of the tabloids. So there was that level of stuff, to contend with. But also now, with, so many things happening as far as
it's a struggling community. Yeah,
it really is because there's this legislature that's coming through that is, transphobic, that is, it's not inclusive.
Yeah.
And it's very, very disturbing. And I don't think people realize how much that truly affects so many individuals, because healthcare is confusing enough.
You and I went over your healthcare needs last year, to try to make sure that post-divorce that, you had something that was going to be suitable for you. And, with all the needs, it wasn't the easiest thing. There was a lot of confusion, and then truly getting what you need becomes super costly if we're talking about, insurance. But I think my feeling is no matter who you are, if you're a human being, if you're a sentient being, so even animals, right? We all deserve, to take care of ourselves, physically be able to take care of ourselves. I was reading actually, reading on this topic not that long ago. And some of the statistics were really saddening. The people that don't seek healthcare, in the community who, for one reason or another, because, it becomes difficult or embarrassing, the provider maybe isn't, really aligned with the particular needs.
Right.
And it's sad. I mean, I think as an entrepreneur, I have also gone without health insurance, actually,
Mhm.
in an effort to save money and try to just kind of, make it through when I was first growing my business. That wasn't easy to do either. And, also there's like the mental health, like the space that goes with that. Like if you're not taking care of yourself, I think it's a pretty important topic. And I think we all deserve healthcare. So
Yeah.
I'm, happy to be a fly on the wall yet again, to be able to listen to a good conversation.
Yeah, and to help dig more deeply into this, I'm speaking with Perry Farhat, who is Director of Diversity, Equality, Inclusion at RWJ Barnabas Health and Admin Director for the Babs Superstein Proud Center and the Proud Gender Center in New Jersey. We'll be right back with Perry right after these messages. Perry, it's so great to have you on. I really appreciate you coming.
Thank you so much for having me, Greg.
Now, all of these names, I'm so bad with names. It's Superstein.
So yes, I am the.
Give me your titles. Give me your titles.
Sure, absolutely. I'm the Director of Diversity, Equity, Inclusion at RWJ University Hospital in Somerset. And I'm also the admin director for the Babs Sipperstein Proud Center and our Proud Gender Center. So those are the things that I do. I have pretty much three areas that I'm focused on.
Yeah. Tell me about the Pride Gender Center. That really intrigued me in your what you do.
Absolutely. So I'll start off with the Babs Sipperstein Proud Center, which is a clinic here at RWJ Somerset. It's a clinic that provides specialized care to the LGBTQ community, primary care specifically. And we focus on primary care for adults, especially when we're doing the various HRT and other affirming types of treatments. We started off in 2017 with only 100 patients, and we've grown significantly in these last 7 years to almost over 1,700 patients. And so we provide primary care in a safe environment where people can be them, where people can feel free to talk about themselves and not feel judged. I know as a gay male, back going to see doctors, it was always very uncomfortable for me.
Right.
There's just so much stigma around our community, especially back then. Now I'm aging myself, but
Right.
it would
No,
be.
I had the same thing. Like when I was diagnosed HIV positive and then going to a doctor, one of my doctors was straight, and and it just wasn't working because the protocols that I was on, it was really challenging because of the side effects, and and I felt like I also felt like I was being judged too, because right,
Many,
because
So your story is not unlike many that we've seen. And we've had patients that have stopped seeing doctors for 6 or 7 years, sometimes 8 or 9 years. So we're playing catch up because of the feeling of being stigmatized, the feeling of not being out yet and trusting a doctor to tell them a little bit about yourself, and then maybe getting an eye roll or a comment or just feeling uncomfortable. And so many people just stay away, and it's becoming an access issue to healthcare, especially with the LGBTQ community. And we found the way to erode these barriers is to create an environment that's safe, that's specialized for this community. So when you walk into our waiting room, you feel comfortable. You don't feel like it's a full room of folks and you can't be you. Because I'll tell you something, and I think you can probably agree with this. The best way for our doctors to diagnose is to accurately know your medical history. And folks aren't comfortable discussing, unless folks are comfortable and patients are comfortable, we're going to have a difficult time getting that down. And so we want to ensure that folks feel very comfortable so they can share their history, so that way we can appropriately serve them.
Right. That's so important, because like when I was with this particular doctor, I was having such a difficult time. I just stopped taking my meds, and then my viral load was like in the millions, and I had 11 T cells, but I just didn't feel like I could discuss openly. And then the nurse who was involved, I said, "Oh, you need to go see this other doctor who happened to be my age, who was also diagnosed HIV positive around the same time I was. He had been on a lot of the same study drugs that were being developed. So he had been through that. So I could sit down. I felt like I was, like you said, I felt like I was in a safe room where I could share everything and not have to censor myself, because, because you're not going to get good healthcare. You're not going to get good care, period, if you're censoring yourself.
That's absolutely right. And Greg, I'm sure your healthcare experience significantly changed when you went to this affirming doctor who just understood the tumults of being part of the community and the adversity. We all share these experiences, and there's something to be said about shared experiences and really understanding each other. And so that's what we try to do here at RWJ Barnabas. I'm very lucky. It's a very mission-focused organization, and they're so focused on the community that we serve. And whether it be the LGBTQ community or the Latinx community, the Black and Brown communities, we're just so focused on that. And I'm just so proud to be part of this organization. And being in a state like New Jersey, that's majority for the most part. I mean, it's a significant amount of people from various communities here in New Jersey. And so in order to provide care to these communities, it's really important to diversify our staff, whether it be doctors who have an LGBT background or doctors who have other shared experiences with our patients, because it helps build trust. And I think the biggest thing is building trust. And once you build trust, then you can really get in there and really understand the patient's history and how to diagnose them appropriately.
Right. Yeah. And it really is challenging, because I've for whatever reason, I have a lot of transgender friends, and in sharing experiences and all what they've been through, just being able to be themselves, and the prejudices, the assumptions that people make, on their behalf. It really is, and also, when you're talking healthcare, you're talking about your own, your own care. It's very, it's very intimate. I mean, you have to have that confidence to be able to share, all of you, to be able to be, accurately treated and humanely treated.
Right. Right. And we do a lot of, as diversity, equity, inclusion director, we do a lot of training here to address the transgender community appropriately with cultural humility and with respect, because that's very, very important. And it's really important to not dead name a patient using a name that person no longer associates with. For example, someone who presents female, using a dead name or their legal name, that would out that person, and that would create a lot of triggering effects on that person. And so we want to be careful. We want to use that preferred name if the name hasn't been legally changed. And the same thing with pronouns. Using pronouns appropriately and correctly and ensuring that folks feel that they are validated, when they come in, because at the end of the day, it's what my mom's golden rule: treat folks the way you want to be treated, and that's it, and
Right.
and I think as long as your heart is in that direction, you'll be able to provide care and services to these various communities.
Yeah, I mean, it's what came to mind was in Avatar, and the character says, "I see you."
Yeah.
That people don't realize how powerful that is, and when you
That's a good point.
are able to appropriately address pronouns, appropriately, have names, you feel seen.
You seem seen and validated.
You
Absolutely.
feel seen and and that's so important for all of us. And it doesn't matter if you're LGBTQAI plus. It's who you are.
Many of us have been hiding forever,
Right? Yeah.
Many of us have been hiding. I think one of the big misconceptions when you talk about the LGBTQ community is mental health, and that we're born with mental illnesses, or that there's mental health implications. And for me, just because I'm gay doesn't mean I have a mental health issues. Just because
Right.
someone's trans doesn't mean that they have mental health issues. This is how I was born. This is for as long as I could remember. And I think a lot of these types of mental health issues, the suicide ideation that you see so heavily with the trans community,
Right.
the depression, the anxiety, all of these things are actually from how society treats marginalized communities, specifically our marginalized community, the bullying,
Right.
and the having to hide in the closet for so many years. And it's enough to make anybody kind of say, you know what, I don't know, like, this is making me feel some kind of way, and
Yeah.
and so I think a lot of people kind of assume that we have mental illnesses and because of who we are, and that's not the case, at least in my experience. My
Right.
experience is that, this is how I am, this is how I was born, and any depression or anxiety that kind of found its way to me is basically from societal
From
pressures.
from
Life. Yeah. Yeah.
life, from societal pressures, what
That's
people making assumptions
That's
on
right.
your behalf,
That's right.
and that happens so often.
How,
And
how many times have I been asked, so you're married, when's your wife going to be here? Like there's
right,
certain
yeah,
things like that. I was like, Joe
right,
wouldn't be happy if you addressed him as my wife.
yeah,
But so we ask. So we do little things like, do you have a partner? Like things like that are just more that I think respect people's various identities, and I think it's really important to do that. You build trust, you build comfortability, you're able to service this community and start bringing down all of these barriers to healthcare, because our community suffers significantly to access. And it's because folks are so darn scared.
yeah. They're scared. They're afraid, because way, in our history. I mean, we used to stone people. They were, persecuted. They were thought of as evil and all that, and it's just crazy, and
It's still
it
the
really
case
is.
in many countries. It's
Yeah,
still the
and
case.
it's still the case in many countries to be. It's a crime to be who you are, but I mean, it's a human right to love and be loved.
Pursuit of
Is
happiness. It's in our constitution,
right.
right?
Yeah, yeah, yeah,
And the
and
pursuit of happiness is to be who you are, and
right.
treat others with respect. And
Yeah,
I during my history, or me growing up, I've always respected everyone others' opinions and where they come and their views of the world, their lenses, how they see the world in their lenses. And part of my job, or part of what I've learned to do, is change one heart at a time,
Right.
the best that I can. But at the end of the day, I'm going to be who I am, and I'm going to treat folks with respect and just hope for that kindness back.
Right. And it really is about kindness. And the thing is, don't be afraid to make mistakes.
That's it. That's
don't
it.
be afraid to make a mistake.
A lot of people are worried about the alphabet soup.
Yeah.
There's a
yeah,
lot.
it is. I mean, all of those letters we're adding, and of course we can laugh about it.
Right.
And, like I tell, many of my friends, I know a lot about the G in the LGBTQAI plus, but I had to learn about those other letters.
Right. And there's so much. And as we become more inclusive, and as we see our community more and become more inclusive in our community, they start adding up. And, at the end of the day, if you don't know, ask the question. It's totally okay. LGBTQ health, it's a journey, and folks are going to make mistakes, and I tell my doctors and our doctors here and our staff members, folks are going to make a mistake, but if it's coming from the heart and you sincerely try, and you apologize for whatever mistake you make, whether it be dead naming or misgendering, if you're sincere about it, 9 times out of 10, folks will understand and correct you. And hopefully from there, you can start addressing that person the way they want to be addressed.
Exactly. And it's funny because I have a dear friend, Dr. Kate Stone, and in her daughters were out, and I referred to Dr. Kate as their mother, and it's like, no, wait. No. It's not their mother. And then I said, Dr. Kate, who are you? So I'm just Kate. So, I mean, it's okay to make the mistakes, address them, so that you're not like skating over it. So, because that creates even more tension.
Right. And you don't want to make too big of a deal about it, because if you make a big deal, then it becomes a big deal. But simply just, apologizing and saying, thank you for correcting me. And best way to show that you're sorry is by action and utilizing the pronoun that validates that person.
Right. And consistency, because it goes back to, I think what I viewed in the avatars, like, I see you, we do want to be seen, and we want to be seen, every person, wants to be seen. And it's so important to recognize and acknowledge that. What do you find is probably some, the biggest challenge that we're coming into in this day and age?
In terms of LGBTQ health?
Yeah.
It's access. It's the stigmatization of various things from our history as a community, and really trying to overcome that stigmatization. I can't say that word right now.
Stigmatization. Yeah, that's a tough one.
It's overcoming that and being able to, get the care that you need and understand that there are places where you're going to be able to feel safe, and where you're going to be able to really share your story and share who you are in a way that can help you get the best health benefits. I think the major issue with this is access to healthcare, access to those providers who provide the affirming care that the LGBTQ community needs and wants, whether it be STI and HIV, to just a primary care doctor, finding people from the community. And what's really wonderful is that as we progress, I've been finding that there's a lot more LGBTQ doctors out there. and folks who really understand the community because they went through it themselves, and
Right.
know what to look for, and know how to ask the questions, and know how to make folks feel comfortable because there's a trust there. So access, I think, is the biggest issue right now. However, hopefully those things change. We're lucky to be in New Jersey, where we have an incredible governor who is such a stalwart of the community. We have a wonderful CEO and president in Mark Manigan that really supports this community and wants to provide care to everybody, anyone in a marginalized community. And also Rutgers, my alma mater university, that provides care to this community. There are places, we're lucky to be in New Jersey. We do have a lot of folks that have moved from other states to come here seeking care. And we welcome them to seek the care that they need. And as long as we are able to, we will certainly provide the LGBTQ community with the healthcare it needs.
Yeah. And, Perry, like one thing that kind of came to mind is like one bad experience. If you're a part of the community, LGBTQIA plus community, one bad experience can really derail you.
Absolutely.
And it takes, because I remember going through having an experience and thinking, oh my God, I'm not going to put myself in that position again. And so it really kind of like what you were talking about is catching up with a lot of these patients because they did have a bad experience. And so then, going back in and trying to, overcome those fears, that, they might treat me,
differently.
Poorly. Because that really holds you back when you have that experience, a bad experience.
And I can share a particular story. I can't use names, I can't use identifiers, but we hear these stories all the time. We had a patient that hadn't seen a doctor in 9 years because when they finally came out to a doctor 9 years ago, the doctor looked at the patient sideways, said, you know what, I'm not really comfortable providing care, but here are some other folks that can provide you care. And he was just like, I just need a primary care doctor. And this patient was so triggered and because he hadn't come out to anybody. And this doctor was the first person that this patient was coming out to. Felt like they could come out to this doc. It's a doctor after all. And they were rejected. They felt rejected. And they hadn't seen a doctor in 9 years until they found us. And so this patient was so happy to be there, so happy to have found the Babs Sipperstein Proud Center. And the story didn't end well, unfortunately, because after doing blood tests and all sorts of stuff, we found that the patient was terminally ill and it was never caught. And the patient did not survive it. And had this patient been able to see doctors, or this may have been caught earlier, this may have extended this patient's life. And so, to your point, one bad experience can truly affect this community, and that's why I say there are hurdles to get for access. There are hurdles. We play catch up all the time. We're catching up in years. And so our appointments sometimes run an hour long, and so many of these adults that come to us, we're doing various tests and they haven't seen doctors in a while. And the stories are just the same over and over and over again.
Yeah, because that one bad experience, and I think what you all do is help someone, take them by the hand and help them navigate all of that stuff in a safe way, in like an affirming way.
That's right. And we spoke about the Proud Gender Center of New Jersey, and so the Proud Gender Center, what we have two navigators, two LGBTQ navigators, and the Gender Center navigates people to affirming doctors. We're not a clinic. The Sipperstein Center is an actual physical clinic. The Gender Center, it's not a clinic, but it's a navigation service. We provide support groups for folks in the community. We provide training to doctors and to nurses to provide affirming care. Hey, make sure you're using the pronoun that's indicated on this sheet. Make sure you're using the preferred name. You know, they do all this training, and they also do outreach to the community. These two navigators, they're incredible. They help navigate through this maze. And if a patient calls and says, "Hey, I need, I need HIV care," our navigator will through the system find them or give them the information of an affirming doctor that will provide that to them. And so we're trying to have all kind of areas covered.
Oftentimes, a trans individual, they're on their own journey of discovery, of who am I, self-discovery. So, and it can be rather confusing and daunting for, that individual, and then navigating through, getting the proper care, having the right questions asked, being heard and being seen is so vitally important, because I feel like we're all doing our best, and hopefully that we are each day commit to doing our best, being kind, and hopefully, being an advocate for somebody, to help, because I've gone on some doctor's appointments with some people who've reached out to me because they just seroconverted, and it was scary going through that process. And so it was like, okay, I'll go and I'll, and I listen to what the doctors say, and I've been on most of the medications, so I had some personal experience too, but able to kind of, when you have knowledge, and experience, it kind of takes away a lot of the fear that might paralyze us or inhibit us.
That's absolutely right, Greg. And luckily we do have the Gender Center that does the navigation service. Again, it's not a clinic, or we don't see patients. I don't oversee doctors or anything like that at the Gender Clinic, Gender Center. We navigate. And if you don't have if you're in a state that doesn't have some sort of navigation service as part of the health system, there are other ways to find affirming doctors. And so one of those ways is a website that it's called LGBTQHealthcareDirectory.org, and helps you finding an affirming doctor near you. However, also do your research. If you see a few doctors near your area on this website or from word of mouth, always do your research. Go into the Google reviews, see what people are saying about those doctors. And if that doctor helps you and is affirming, and you feel like this is wonderful, share it with the community and share it with your friends. So that way folks start to know, where can I go to get this care that I need? Because it's just tragic to see how many people are getting sick, and it's a public concern, right? We want to make sure we see everybody from all marginalized communities, not only because it's the right thing to do, but if we're not providing care to LGBTQ folks, right, they go back into the communities and they're getting everybody else sick, right? So we want to make sure, as a public policy kind of aspect of this, that folks are getting the healthcare that they need and access to the healthcare that they need.
So what can listeners, what's the best strategy to be in service, to help? What would you say as a call to action?
As a call to action, say vote.
Yeah. Yes.
I'd say vote. That's the biggest one. I think that's really important. As various legislation is passed in various states, I think it's important for the community to vote for what they want in their state, and for allies to follow suit.
Just
You know,
to support their friends, family, people who they profess to love, and that you can support them by really voting.
by voting for a
Truly,
state
yeah,
legislator, for a
yeah,
congressperson, for a state senator, vote. Just vote.
yeah.
Know the record and vote. I think that makes a big. That's what makes the difference when it
The
comes to
difference.
legislation and laws.
Yeah,
Voting for
yeah,
somebody who sees you and who understands LGBTQ healthcare and the
and
community
other
in general.
issues.
Oh,
Yeah, yeah.
absolutely. And my
Oh,
s- and my
so many
sec
issues.
no, and my second call to action is really when you see something, say something. I think the most
Yeah.
powerful things are when somebody is not in the room from the
Hmm.
LGBTQ community. And, for example, my dad was out in the supermarket, overheard someone using a derogatory term, and would say, "Hey, that's not cool. Like, that's not
Hmm.
something you should be saying in public." My dad's not shy,
Right.
but um, those are the types of things supporting the community in front of them, but also
Mhm.
when they're not around. I think it
Right.
goes far, and I think it shows, hey, this may not be that acceptable to use these terms and to be this way.
Right. Yeah, I mean it's so important for, especially like for the individual that you might be standing up for, because then they feel seen, they feel
Supported.
supported,
Yeah.
and and navigating this world, we want to have people in our corner, and not setting aside, pushing people away, that they're separate, because we're all trying to do the best we can.
That's right. That's right. And you experienced it personally in your healthcare journey, and I can't even
Yeah,
imagine what that was like. Just trying to
yeah.
navigate that at that time and all of that. So you are an inspiration to many, including myself.
Well, thank you
And
so much.
you're it's just incredible, your story, and I'm just so glad you're still with us here today.
I know, right? I really, I didn't expect to be here, because like, diagnosed, I was 28, and it says like, get your affairs in order. I didn't think I'd see my 30th birthday, and
No,
now I'm like, 63,
no.
right? And still going. So yeah, trying to figure out what the hell am I doing here?
I think we're
But
all trying to
right,
figure out what our purposes are,
right.
right?
Spreading kindness, and how we can,
And awareness. Yes.
yeah,
Yes.
how it can be of service to others who may not have the same opportunities, and
And
things that we do.
and using
But
your platform to do that is life
yeah,
saving. It truly
yeah,
is.
yeah. So get out and vote. Know what you're voting for, and know that you're voting for your loved ones.
That's
And stand up for, don't let things pass. If you hear something, or witness something that is not right, of course, be safe, your safety first, but speak up. It's really important that, I think that the majority of us are kind, and trying to do the best that we can.
I think so.
Yeah. So, support the kindness.
Support the kindness.
So yeah. So Perry, thank you so much for joining me.
Thank
This
you
was
for
great.
having me.
I love the work that you're doing, and the proud, gender, all that stuff is so wonderful to help people navigate through the healthcare system in a affirming way, and to be able to be kind to ourselves so that we can be kind to others.
Thank you for having me, Greg. It's not every day that I speak to an incredible Olympian. This is pretty stars. I was a bit starstruck when I was reached out to. Thank you for having me. Thank you for using your platform to spread awareness and for all that you do. You're an inspiration to the community, and I cannot thank you enough for having me.
Thank you, Perry. Really, really appreciate your time, and we'll connect again down the road.
Sounds
for sure.
Good. Anytime.
I love the work you're doing.
I appreciate you. Thank you so much.
Thank you for joining us for another episode of Greg Louganis is Alive, the podcast that challenges what you think you know. What a wonderful conversation with Perry, talking about healthcare and navigating that. If you got anything from the podcast, please share, especially the connections to the websites that somebody might be having some issues in navigating that healthcare question and being able to be the best advocate for themselves. Share that with loved ones. Till next time, namaste.
Yay Networks.